Blessed day, Happy New Year! I'm Aria Herrera and I will discuss about the approaches to guidance counseling. There are a number of different approaches used by professional counselors. Perhaps there are three main approaches: are psychodynamic, humanistic, and behavioral. Each of these has a different theory and ideas underpinning it, and the therapists and counselors using each will approach problems and issues in different ways. Here are the main topics that we're going to discuss in this report. The approaches to guidance and counseling. First is psychodynamic approach to counseling by Sigmund Freud. Second is humanistic approach to counseling and client-centered counseling by Carl Rogers. Third is the behavioral approach to counseling. We're going to discuss each on the following slides. Psychodynamic counseling evolved from the work of Sigmund Freud. During his career as a medical doctor, Freud came across with many patients who suffer from medical conditions which appear to have no physical cause. This led him to believe that the origin of such illness lay in the unconscious mind of the patient. Psychodynamic counseling is based on Freud's idea that true knowledge of people and their problems is possible through an understanding of three particular areas of human mind. Freud maintained that the personality consists of three related elements. Do you remember that? The id, the ego, and the superego. Okay, let's recall it. The id is the part of our personality concerned with satisfying instinctual basic needs of food, comfort, and pleasure. While the ego is defined as the realistic awareness of self, it is logical and common sense side of our personality. And the third one is the superego. The superego curbs and controls the basic instinct of the id, which may be social and acceptable. It therefore acts as our conscience. Freud believed that everybody experiences tension and conflict between three elements of their personalities. For example, desire for pleasure from the id is restrained by the moral sense of right and wrong from the superego. The ego balances the tension between the id wanting to be satisfied and the superego being over strict. The main goal of psychodynamic counseling, therefore, is to help people to balance the three elements of their personality so that neither the id nor the superego is dominant. It is rooted in exploring and understanding past experience to identify repressed issues that are affecting current behavior. Psychodynamic counseling is therefore a long and ongoing process and is mainly used when people are experiencing severe problems that are not resolved using other methods. Humanistic approach to counseling. Humanistic counseling recognizes the uniqueness of every individual. It assumes that everyone has an innate capacity to grow emotionally and psychologically towards the goal of self-actualization and personal fulfillment. Humanistic counselors work with the belief that problems are not caused by life events themselves, but how we experience them. Our experience in turn will affect and be affected by how we feel about ourselves, influencing self-esteem and confidence. The humanistic approach to counseling therefore encourages the client to learn and understand how negative responses to life events can lead to psychological discomfort. The approach aims to self-acceptance of both negative and positive aspects of our characters and personalities. Humanistic counselors therefore aim to help clients to explore their own thoughts and feelings and to work out of their own solutions to their problems. This is very similar to the approach used in coaching, except that coaches are more focused on the present and less on the past. In essence, coaching aims to address the issue of how, and counseling works at why. Client-centered counseling. The American psychologist Carl Rogers developed one of the most commonly used humanistic therapies, client-centered counseling. This encourages the client to concentrate on how they feel at the present moment. This is also the essence of mindfulness. The central theme of client-centered counseling is the belief that we all have inherent resources that enable us to deal with whatever life brings. Client-centered therapy focuses on the belief that the client and not the counselor is the expert of their own thoughts, feelings, experiences, and problems. The client is therefore the person most capable of finding appropriate solutions. The counselor does not suggest any course of action, make recommendations, ask probing questions, or try to interpret anything the client says. The responsibility for working out problems rests fully with the client. When the counselor does not respond, their aim is to reflect and clarify what the client has been saying. A trained client-centered counselor aims to show empathy, warmth, and genuineness, which they believe would enable the client's self-understanding and psychological growth. Empathy involves being able to understand the client's issues from their own frame of reference. The counselor should be able to accurately reflect this understanding back to the client. Warmth. It is to show the client that they are valued regardless of anything that happens during the counseling sessions. The counselor must be non-judgmental, accepting whatever the client says or does without imposing evaluations. Genuineness refers to the client's ability to being able to be open and honest and not to act in a superior manner or hide behind a professional facade. The behavioral approach in counseling. The behavioral approach in counseling focuses on the assumption that the environment determines an individual behavior. How an individual responds to a given situation is the result of past learning and usually behavior that has been reinforced in the past. For example, suppose that a child picked a spider and took it in the mother. If she was frightened of spiders, she might scream. The child would then learn that spiders are frightening. Next time, instead of picking up the spiders, the child would probably scream and run to their mother, who may say, "Oh, I hate spiders, they are so creepy." Reinforcing the child's behavior as a result, the child may develop a fear of spiders and run away screaming as a response, and the sight of spider as a stimulus. Problems which responds well to the type of therapy includes photos, anxiety attacks, and eating disorders. Clients might be taught skills to help them manage their lives more effectively. For example, they may be taught how to relax in situations that produce anxiety response. Another method involves learning desirable behavior by watching and copying others. In general, behavioral approach is concerned with the outcome rather than the process of change. Using different counseling approach. This three broad approach to counseling each underpin a number of individual therapeutic approach. However, some counselors and therapists may draw on more than one of these three approaches. For example, neuro-linguistic programming on NLP is a combination of cognitive behavioral and humanistic thinking. Therapies like art therapy, family therapy, and creative therapy may all be drawn on ideas from any or all of these approaches, depending on the counselor and client's preference. This is, in other words, no one size fits all when it comes to counseling. I put down the link of the sample videos of that topic that I've discussed today. Please watch it. Thank you for listening.